Welcome to our 2018-19 annual report. This is our 6th year of being the lead commissioner for healthcare services in Salford. We commission many different services for the people who live in Salford. We have a population of over 250,000 now registered with our GPs. Services that we buy for the population include hospital, community, primary care, mental health, so a wide range of services. We have membership practices, so all 45 GP practices across Salford are members of the CCG. Why is that important? Well, it means that clinicians that are involved in day-to-day care of looking after their patients are involved in the decision-making around the buying of services. So we are very much a clinically led, expertly managed organisation. So I hope that you enjoy the annual report and that you find it an interesting view of what we have achieved in 18-19.
Through a quality improvement programme called Safe for Salford, we aim to be the safest health and social care system in the UK. We've been working with care homes across Salford to share learning about medicine safety, infection control, care planning and risk assessment. In the last 2 years, the number of care homes rated good by the Quality Care Commission have more than doubled, and the number rated inadequate or needing improvement has dropped from 67% down to 20%. Our Innovation Fund tests new ideas and ways of working across primary and secondary care and the community and voluntary sector. So far, we've invested more than £6.6 million since 2013. A lot of our Innovation Fund is used on prevention projects like Tougher Minds, which helps primary school children build their confidence in managing their emotions as they grow older and strengthen their emotional health and well-being. With partners, we continue delivering Healthier You, a behaviour change programme helping people with diabetes change their lifestyle. We approve plans to introduce lung health checks for 2019-20. 44 of our 45 GP practices in Salford now have a non-clinical cancer champion. The champions are trained by Cancer Research UK to spot early signs of cancer and pass this training on to their practice colleagues. We took part in Crucial Crew, speaking to 1,500 Year 6 pupils, encouraging them to be sugar smart. We've delivered a Stoptober communications campaign seen by 1 million people on social media and almost 1,000 visits to a stop smoking support website. We work with people living with dementia and their carers to develop a campaign raising awareness of vascular dementia prevention. We are the first city in Greater Manchester to develop a memorandum of understanding to set out how we will work together with the voluntary, community and social enterprise sector. A big part of our work with the VCSE sector is through the Third Sector Fund. This is organised by Salford CVS and funded by the CCG with support from Salford City Council. Set up in 2014, the fund has awarded grants to more than 300 voluntary organisations, community groups, social enterprises and schools for health and social well-being. In 2017, we announced an extra £3 million to be made available through the fund to March 2020. This is the only area in Greater Manchester to invest our entire share of mental health transformation funding into the VCSE sector. We use this money to launch a new emotional wellbeing and mental health fund, which is coordinated by Salford CVS and funded by the CCG and Salford City Council. Over the next 3 years, more than £850,000 will be awarded to organisations helping to meet the mental health needs of people in the community. Salford Together is a partnership between Salford CCG and a number of health and care organisations. Through Salford Together, we introduce a Salford Urgent Care team who work with the ambulance service to avoid unnecessary transfers to A&E. We also introduced a new fall service and led an awareness campaign, giving simple tips and advice on how to prevent falls. As the Bolton, Salford and Wigan partnership, we are working with our neighbouring CCGs and hospitals to look at the way we make our specialist and acute hospital services more resilient and fit for the future, focusing on dermatology, breast services, neurorehabilitation, paediatric general surgery, elective orthopaedics and benign neurology. Ingleside Birth and Community Centre opened in April 2018, welcoming more than 100 births in its first year. In partnership with organisations including Salford City Council, Salford Royal and Greater Manchester Mental Health, we spoke to people with personal experiences of mental health problems, carers and staff, to produce the mental health all-age integrated commissioning strategy. This sets out our plan for the next 5 years and for the first time focuses on emotional well-being and mental health throughout people's lives, including children, adults and older people. Salford also became one of the 4 locations in the UK to receive National Lottery funding through Living Well. This is the start of a 3-year programme, working in partnership with the voluntary and public sector organisations to support people living with mental health problems get the help they need quickly so they can live well in the community. And we continued our work with Salford Suicide Prevention Partnership to raise awareness of the signs of suicide and how to have a conversation about suicide prevention. Our other highlights include being rated as an outstanding CCG for the 4th year in a row. Our diabetes care and dementia care were both rated outstanding after being rated as requiring improvements the previous year, and we are the 7th best performing CCG nationally for dementia diagnosis rates, making us the best in both Greater Manchester and the North West. A key piece of work has been the publication of our first social value strategy, explaining how we continue to use our resources responsibly, including prioritising care closer to home, which reduces the need for avoidable travel to appointments for people in Salford. As part of this work, we have also achieved Silver Carbon Literacy accreditation, continued our role to encourage the Salford health and care system to implement the living wage and become a partner of the Salford Credit Union. Finally, our engagement work. Between April 2018 and March 2019, we've involved more than 6,000 citizens to shape our plans for healthcare in Salford. We talked to people about a wide range of topics to get some of their views. These are some of the things we spoke about: mental health, suicide prevention, RHS Bridgewater, dermatology, healthy eating, cancer, social care services, care navigation, urgent care teams, dementia, supported tenancies, safeguarding adults, special educational needs, over-the-counter medicines, autism, learning disabilities, digital health, poverty, innovation, carers' needs, and the NHS long-term plan. This is only a snapshot of everything we've worked on over the last 12 months. If you'd like to learn more, our annual report and accounts are available at our website, www.salfordccg.nhs.uk.